Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Understanding a fear of holes and small bumps. Trypophobia is an intense fear of holes or disgust for things with clusters of small bumps. A person may feel anxiety along with physical symptoms such as goosebumps, itching, and nausea when they see objects such as a honeycomb or sponge. Snakeskin patterns or repeated bumps like those on fruit can also trigger the fear. /r/n/r/n Researchers disagree about whether trypophobia is a true phobia, and it's not officially classified as a mental disorder. However, studies show people can have significant adverse reactions and may meet the criteria for a phobia if symptoms interfere with everyday living. /r/n/r/n In severe cases, people with trypophobia may benefit from therapies or medication commonly used for anxiety disorders. /r/n/r/nVerywell, Laura Porterrnrn Like other phobias, trypophobia manifests with both a psychological response and an autonomic nervous system response. These reactions accelerate a person's negative experience because extreme emotions spawn physical symptoms and vice versa. /r/n/r/n People with trypophobia may experience some or all of the following physical and psychological symptoms. /r/n/r/n People with phobias tend to avoid the object or experience that triggers symptoms, which can make it more difficult to function in certain circumstances. /r/n/r/n Trypophobia can be triggered by a range of objects and patterns. These can be things that occur in nature or man-made objects. Studies show that people with trypophobia may have negative reactions to the following. /r/n/r/n In addition, people may experience anxiety and disgust when they view similar objects such as /r/n/r/n Trypophobia can also manifest as an extreme aversion to patterns associated with certain skin diseases. These might include conditions such as chickenpox, parasitic infections, or ichthyosis, which cause bumps and patterns on the skin. /r/n/r/n It's estimated that 10% to 18% of adults experience at least some anxiety when they see clusters of small holes. However, whether this reaction should be classified as general disgust or an actual phobia is debated. /r/n/r/n Trypophobia wasn't well known until recently. The term was first coined in 2005 in an online forum where participants claimed to have a fear of objects with closely packed holes. /r/n/r/n The word for this fear was derived from the Greek words trypa, hole or cavity, and phobia, fear or aversion. /r/n/r/n Based on this history, some have claimed that the rise in people claiming to have a fear of holes is a result of internet conditioning. However, a 2024 study found that the association between holes and anxiety existed long before the internet. /r/n/r/n Some researchers believe the initial disgust a person feels toward clustered patterns may begin as a fear, but with negative reinforcement and continued avoidance, can evolve into a phobia over time. /r/n/r/n Usually, experts make a diagnosis of a phobia according to the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, edition 5 DSM-5. However, it's been difficult to determine if trypophobia meets the conditions for a specific phobia because researchers interpret the condition differently. /r/n/r/n Some researchers point out that people claiming to have trypophobia exhibited disgust upon seeing clustered patterns, but not fear. This, they say, would disqualify the phenomenon as a phobia. /r/n/r/n Other scientists point out that DSM-5 doesn't separate fear from anxiety when outlining the diagnostic criteria for specific phobias. /r/n/r/n Trypophobia may meet those 7 criteria in the following ways. /r/n/r/n Phobias don't have a specific cause. Instead, they can result from any number or combination of complex factors. These may include genetics, prior trauma, learned responses early in life, and long-term anxiety or depression. /r/n/r/n with trypophobia, some scientists believe the cause may be at least partially evolutionary, resulting from humans' natural responses to the following, /r/n/r/n. However, this theory that trypophobia results from an evolutionary need to protect oneself from danger needs further research. /r/n/r/n. Since trypophobia isn't recognized as a specific condition, there are no clearly established recommended treatments. However, people diagnosed with a specific phobia are typically treated with psychotherapy and, if needed, medications. /r/n/r/n treatments include /r/n/r/n. If you or a loved one are struggling with anxiety or a phobia, contact the Substance Abuse and Mental Health Services Administration, SVSA, National Helpline NEAT 1-800-662-4357 for information on support and treatment facilities in your area. /r/n/r/n. Trypophobia is defined as an irrational fear of objects with clustered holes and may apply to things with bumps or patterned skin. It isn't recognized as a diagnosis by the Diagnostic and Statistical Manual of Mental Disorders. However, studies show that it can negatively affect daily life. /r/n/r/n. You may be able to manage the anxiety or physical symptoms that come with trypophobia by avoiding triggers and getting help from a therapist or doctor who specializes in treating phobias and anxiety disorders. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.